Okay. All right. We want to thank you. The Ministers Alliance would like to thank you for coming on and being on with us. My name is Pastor Pam Bird. I am the Secretary of the Ministers Alliance. And we have been having this cancer initiative for over 2 months now, talking about the different initiatives, the different ways and education, and wanting you to know, excuse me, wanting you to know more about cancer screening. That is our goal. Our goal is to get you to have cancer screening. And the main cancers of screen, the main cancers that we are focusing on is lung cancer, breast cancer, cervical cancer, colon cancer. And we are also focusing on prostate cancer for the men. So, and then we realized that there are cancers also, breast cancer for men as well. So we need to educate our community. We need to let everyone know that cancer screening is a is it's really can save your life. It can save your life. It can save our lives. So we are looking forward to hearing from Dr. Best and everyone that is online here. We are focusing today. We have been focusing on the cancers, but today we want to focus on the HPV vaccination. So we are going to let everyone know we do have a survivor. She is not on yet, but we really want to focus on that because there has been many questions, Dr. Best, throughout our community conversations, and the HPV vaccination always come up. And so today we would like for you to really educate us on that vaccination. But again, we want to thank everyone that is here. The Ministers Alliance of Rhode Island is made up of a group of churches and ministers and pastors. Pastor Howard Jenkins from Bethel AME Church is our president. We have with us today our Reverend George Foley, who is our vice president. His church is Unity Chapel in Cranston. I am the secretary. My church is Trinity Tabernacle here in East Providence. And then we have our treasurer, which is Reverend Laurie Smalls, which she is the pastor of the church in New Bedford. So we have been having these community conversations throughout Rhode Island. If anyone is interested in having these conversations at your church, at a community center, please contact us because we want to spread the word. We want to spread this cancer initiative and educate our community that cancer does not have to be a death sentence. So we are really focusing on screening, screening, screening. So right now we're going to give it to our Dr. Best, who is part of the Planned Parenthood, and I'm going to let her introduce herself. So take it away, Dr. Best.
Good morning, everybody, and thank you for having me, Pastor Pam. Great to see you this morning. My name is Aiti Maharaj Best. I use she, her pronouns, and I am the medical director for PPSNE, which is Planned Parenthood of Southern New England, which spans 15 health centers across Rhode Island and Connecticut. Our closest one for most of you all would be 175 Broad Street in Providence. And I am a family physician. That's my professional background, a primary care doctor, and now the medical director at PPSNE. So, cancer screening and prevention is really a critical part of my focus as a family doctor. And the topic that Pastor Pam asked me to talk about this morning is the HPV vaccine. So we've had conversations about cancer screenings, like your pap smear, which is how we screen for cervical cancer and precancerous changes in the cervix. But when we think about the HPV vaccine, what we're really talking about is even upstream before, even screening to look for cancer, we are trying to prevent cancer. So what is HPV when we say HPV vaccine? HPV stands for human papilloma virus, which is a virus. As you all are familiar with viruses, they're organisms that can be spread from person to person through physical contact. And the HPV virus is actually the virus that is responsible for the vast majority of cases of cervical cancer. Now, I feel very passionate about the topic of cervical cancer because cervical cancer is the cancer that we really know the most about in the medical field. We know what causes cervical cancer, which is this HPV virus. We don't have that information for a lot of different types of cancer. We don't have the, privilege of that level of understanding to know why some people get breast cancer, right? We know there's genes involved and things, but we don't have that same level of detail to be able to identify one single cause that we know is responsible for almost all cases of a type of cancer. So for cervical cancer, we know that almost all cases of cervical cancer are caused by this HPV virus. And as a result of that, science has led us to this point where we know if most of the cases of cervical cancer are caused by the HPV virus, if we can vaccinate people to prevent them from getting that virus, even if they get exposed to it, right, prevent them from getting infected with that virus, we actually can prevent most cases of cervical cancer, right? And that's really the gold standard, right, of what we are aiming for, right? We talk in these conversations about all of the stages where we can intervene to prevent people from suffering and from dying from cancer, right? There's the access to treatment, but if you go earlier than that, early diagnosis, that's why we want people to be, screening with their mammograms and, their tests for prostate cancer and things. And then earlier than that, there's some types of cancers where we can test for pre-cancer. Cervical cancer is one. That's what pap smears are looking for, is for pre-cancerous changes. But this is the only one where we have a step even earlier than that, where you can actually get vaccinated before you even get exposed to this virus that leads to cervical cancer. You can get a vaccine that will protect you against that virus. So, there is this is a common vaccine, the HPV vaccine. You might hear, names like the Gardasil vaccine and things like that. But the HPV vaccine protects against 9 different strains of this virus that cause, like I said, the majority of cervical cancer cases. And this is a virus that's commonly given around the world. And so there are lots of studies in, the United States and in other countries, Sweden, Australia, and different places that show us that since this vaccine became recommended and routinely administered to adolescents, between the ages of 11 and 18, let's say, um, there have been there has been a decrease in the rates of cervical cancer in communities that have high rates of accepting and taking up this vaccine. They have seen as much as a almost 90% decrease in the rates of cervical cancer in those communities. I want to say that again, 90% decrease in the number of people getting cervical cancer when they, universally implemented access to this vaccine. So I think we're sleeping on this. When you really look at the rates of cervical of vaccination against the HPV virus, vaccine rates continue to be actually quite low in our community in Rhode Island. A lot of people don't seem to be getting this vaccine at the age when it is recommended, right? And so when do we recommend the HPV vaccine? You can actually get it as early as 9 years old. The routine timing is between 11 and 15, but you can get it as early as 9. And the goal of this is, as with any vaccine, you want to get the child vaccinated before they have been exposed to the HPV vaccine virus, right? Because the virus cannot cure, sorry, the vaccine cannot cure a virus that you already have. It can only help to prevent you from getting an infection when you get exposed. So that's why it's really important that parents get their children vaccinated in that early adolescent period, 11, 12, 13 years old would really be the goal, so that they are protected and their immune system has time to respond and to, generate that antibody immune system response against the HPV virus before they have been exposed to HPV. Okay. In terms of what the vaccine series looks like, it's either 2 or 3 shots, 2 or 3 doses, depending on how old you are when you start the series. So if your child gets vaccinated at younger than 15, they only need 2 doses, and that has been shown to, give them full protection. If they start their vaccination series at 15 or older, then they actually need 3 doses. So that's another reason to get vaccinated early. They get 2 shots and they get all the protection and coverage they need. Whereas if they start it later, after 15, then they actually need an extra dose to get that full response. So this is something that, people, kids should be getting with their routine, primary care when they go for their annual school checkup. Normally your pediatrician or your family doctor will talk to you about the HPV vaccine, starting around 11. They have that conversation. And it's 2 shots at that age, and then you are done. And that protection does seem to last well. It's not one where you need, a booster every few years or anything like that. So we really want to get the word out to parents that this is something that they should be, accepting when it's offered. And if your pediatrician does not bring it up, and you have a child who's 11 or older, you should be bringing this up to say, hey, doc, what about HPV vaccine? I don't want my child to get cancer. And I heard that there's a vaccine that can prevent cervical cancer. Can I get that vaccine? Do you offer that vaccine? If you don't offer it, where can I go to get vaccinated? Right. But most pediatricians' offices and family primary care offices should be able to offer that vaccine. The vaccine is very safe. It's not one that is associated with any types of, serious side effects or, any long-term issues or anything like that. Really, the most common side effect, if anything, is just some soreness. You get the shot in your arm. You might be a little bit sore there for 48 hours. And that's kind of about it. It's a very safe, well-tolerated vaccine. But we have seen since the pandemic, especially, a lot of kids miss their doctor's appointments in 2020, 2021, and 2022. And we have yet to see all of those kids come back and get caught up with getting their HPV vaccine since then. And we do not want to see that turn into now, a generation of people getting cervical cancer at higher rates because they did not get their vaccine. So we really need to make a push to get those kids vaccinated. I'll add, so I've been saying about kids, but I'll add one more thing, which is the vaccine is recommended for anyone age 11 to 26. And then you actually can get, there is some studies and evidence that the vaccine can be beneficial for people up to age 40, 45. So if the only reason that the vaccine may be less beneficial for folks as they get older is because the chance that you might have already gotten exposed to HPV as you go on and you live your life and you're in relationships and everything, you may have already been exposed, and therefore the vaccine is not going to be able to, protect you if you're already exposed. But there is some evidence that even for folks up to age 45, it can still be beneficial, and definitely up to age 26, it's recommended. Okay, I'll pause there. Any questions about that? Comment.
Oh my goodness.
Pastor Pam, you look like your video might be stuck.
Yeah, I just seen that I was just stuck, but I'm glad that it didn't cut off. Um, when you was talking about exposure, can you explain more about the exposure of HPV?
Absolutely. So the HPV is a virus that can live in different parts of the body. It tends to live in what we call the mucosa. So that's like, for example, the gums of your mouth, the pink parts, basically. So it's something that can live inside of the vagina or in the cervix, right? Because we're talking about cervical cancer. So that virus can live anywhere inside the tissue or the walls of the vagina or the cervix. And it actually, again, we're talking about cervical cancer here today, but the HPV virus, because it can live in those parts of the body, it actually is a major cause of vaginal cancer too, which is something we don't talk about as much as cervical cancer, but it is a thing that, I have certainly seen among my patients and something that exists. So the HPV virus can live in the vaginal walls, it can live in the cervix, it can live in the genitals, so it can live on the penis, it can live in the mouth. So any of those parts of the body can carry an infection, and those any contact with those parts of the body can spread an infection. So typically we think of HPV most commonly as a sexually, transmitted
Yeah.
virus. But it can also be shed, by oral contact. So whether that's kissing or it can be, spread by sharing of like oral secretions, so potentially sharing, beverages and things like that, that you can spread HPV that way. And so that's why we think of the, age, the younger that you get a child vaccinated, the less likely they are to have had that type of contact. And so the more likely you are to be able to protect them um, before they get exposed. Now, something that we hear sometimes from parents is that they worry that getting their children vaccinated is going to make them become sexually active at a younger age. And I just want to speak to that because I think that that is a big hurdle psychologically for parents sometimes when they hear that this can be sexually transmitted. Now, like you heard, it's not only sexually transmitted. So, anyway, that's just not true. But also, I don't think that, for my patients, who are young people, I don't think most young people are necessarily thinking that the reason they might be delaying becoming sexually active is because they don't want to get HPV, right? There's a lot of reasons that people weigh when they decide when they want to become sexually active, and I don't think HPV is usually at the top of the list for most people. And so I think that, that's just a myth or a misperception, that sometimes gets in the way of this really important prevention. But I also think that at the end of the day, what we're talking about here, we have to remember is cancer, you know? And when, we, all of us in this space, I'm sure, have had our lives touched and affected in some way by cancer, and to think as a parent, right, about a cancer for your child, how could you not want to do everything that you can to protect your child from that, right? And the goal, as we talked about, is to get children so early, that we can be confident we're getting them before they have had any type of exposure, ideally before the age of sexual contact, so that we can protect them well before that's even a consideration, in their life. We don't want to wait until right before, right? We want to make sure that their body has the time to receive this vaccine, to react, to mount that immune reaction, to be able to protect them when that time comes. But also, if they might be exposed in any of those other ways, non-sexual contact as well to this HPV virus, because there is also an increasing rate of oral cancer, mouth cancer, related to the HPV virus as well. Again, something people don't talk about as much, but it is definitely something that we are seeing in the medical field.
That is great. That is great information. I do have another question. We have been having genetic counseling in these community conversations. We understand that sometimes in different families, because we are letting families know. Let's talk about the cancers, who, what did grandma die from, what did, so there may be a genetic of cervical cancer or whatever. Would you recommend the HPV, which you do recommend, but what I'm saying is, for people that cancer runs into the family, would that be a great prevention?
Yes, that is a fantastic question, Pastor Pam. So this is why I was saying at the beginning, cervical cancer is a really unique and fascinating type of cancer because it's the only one we know that we can really tie almost all of the cases back to this HPV virus. And so for, some other types of cancer like breast cancer, ovarian cancer, uterine cancer, there seems to be a stronger genetic relationship where, if your mother or your sister, had this type of cancer, your risk tends to be increased. With cervical cancer, it really seems that the common factor, the common denominator above everything else is the HPV virus. So even people whose parent, whose mother or sister or aunt, close relatives died from or had cervical cancer, if they receive the HPV vaccine before they get exposed to HPV, before they, are infected with HPV, they're going to be part of that 90% decrease in cervical cancer. It does protect people regardless of your genetics. It seems that this vaccine is actually extremely effective, regardless of how many cases of cervical cancer you may have in your family. um and a lot of the, you know like you said, a lot of those cases may where people have family members who had cervical cancer, those are typically related to the fact that your family member got exposed to the HPV virus and they did not have protection. They didn't have a vaccine, right? And then usually the thing with cervical cancer as well is, the vaccine is meant to prevent HPV infections. And then for folks who either or, might be hearing this talk and they already have been infected with the HPV virus, um, or for the rare cases of people who have been vaccinated and who still get the HPV virus, getting your regular cervical cancer screenings can be extremely beneficial and effective in preventing people from even developing cancer. So I'll take a little tangent briefly. I know the focus is the vaccine,
Yeah.
but what we really are, the topic of this day is cervical cancer, right? Prevention. So when you get your pap smear, what is typically what we are thinking of. When you get your cervical cancer screening or your pap smear, what we are doing in a pap smear is we look at your cervix and then we take a swab and we test that swab. It's just like a Q-tip, right? You test that for any abnormal cells and you test it for the HPV virus.
Mm-hmm.
And there's actually a movement now in the field of cervical cancer screening that we are moving more and more towards just testing for the HPV virus and just focusing our testing on that, because we find that that is actually proving to be the most reliable way to predict who is at risk for developing cervical cancer is if you have the HPV virus. And we will, check it again, usually in a year or so, and we watch to see if your immune system gets rid of that virus and fights it off, or if the virus lingers in your body. Then we know that you are somebody who is at increased risk to develop cervical cancer. And we watch those results, if you have the HPV virus, we watch it, every year usually. And then if it eventually it doesn't seem like it's going away and your body is fighting it off, we can recommend procedures to get a closer look at the cells and look for precancerous changes. And again, we can, monitor precancerous changes. And if we start to see a precancerous change developing and it looks like it's, you know, um, progressing along the pre-cancer spectrum before it becomes cancer, we actually have procedures to just scrape off or burn off those cells so that they never have the chance to become a cancer at all. Right. So this is where we have such fantastic tools for preventing cervical cancer that we really don't have for many other types of cancer, except maybe colorectal, right? For most other types of cancer, we are focused on early detection, right? And lifestyle prevention. But we want to do early detection so we can catch on cancer early to treat it early. With cervical cancer, we have the tools to recognize it before it becomes cancer and even to prevent cancer altogether. So that's why it's so important to get your vaccine. And even when you've had your vaccine, get your regular pap smears so we can recognize if you need to get some cells removed, and we can actually prevent almost all cases of cervical cancer. So it really breaks my heart when I see people being diagnosed with cervical cancer, and worse, people dying from cervical cancer. It breaks my heart because I know that we had the tools to do better.
Mm-hmm. And this is where this cancer initiative is, where we need to push that we need these screenings in our community so that they don't have to be that far. Because from what I've been learning, we have been learning so much, so much. And a lot of people do not survive when it gets to stage 4, but we want to detect it as early as possible. I am a breast cancer survivor, and I had the mammogram every year, and thank God that I had the previous year was good, but then that year they seen the changes, so we were able to prevent it and do the treatments that needed to be done. And it also prepared me for when I got older. And so, and with cervical cancer, I even like to discuss that with women, especially older women, that with fibroids. And can we talk about that a little bit, if you don't mind?
Sure. About what, fibroids?
The fibroids for older women. I know we were talking about the HPV vaccine, but since we are talking about cervical cancer, there, especially upon amongst the BIPOC community, women have fibroids, and I know that some say that they wait until it's really huge because it does grow and it feeds off. But can you just talk a little bit about that?
Sure. So one thing I'll say, like you said, is, fibroids are very common, and they do seem to be more common in Black women and women of color. Fibroids themselves are typically what we call benign, right? So fibroids are not typically cancerous. Um, they can be very bothersome, and sometimes they can be dangerous, even though they're common. The most common symptoms of fibroids are heavy bleeding or irregular bleeding. So either when you have your period, you have heavier menstrual periods, or your periods might last longer, where the average for the length of a period might be 4 or 5 days. People with fibroids might be having a period for 7, 8, 9, 10 days sometimes. And just having heavier bleeding, sometimes bleeding in between periods for, uh, unexplained or unexpected, or we call it unscheduled bleeding, or painful periods. Very painful periods can be a symptom of fibroids as well. And like I said, they're common, and the rates of fibroids do increase with age as well. So you may not have had fibroids when you were 20. Maybe you had an ultrasound for some other reason, and you know that they never told you you had fibroids on that ultrasound, and then you start to develop these symptoms later on. It is possible to, people are not born with fibroids. Fibroids are something that grow and develop over time, and the number of fibroids, and the symptoms related to fibroids can increase over time. And I think that is, so they're not cancerous. So it is a different condition. It's fibroids don't increase your risk of uterine cancer or cervical cancer, but I do think it's important to have that awareness, because first of all, we have treatments for fibroids, and fibroids can really affect people's quality of life, and they can cause anemia, fatigue, and just a general, impact on quality of life because of the painful, heavy bleeding and things like that. But also, it's important to, um, be aware of that because some of the symptoms of a cervical cancer can also be unscheduled bleeding, right? Bleeding when it's not time for your period. So if you had a cancer of the cervix or a mass in the cervix or something, that can also bleed and cause those types of symptoms. So it is important for people you know, to be aware, I guess, of that overlap. And again, I think the best thing you can do is to make sure that besides your HPV vaccine, once that's done, you get your 2, 3 doses, that's done. You don't have to think about it again. So the best thing I think people can do is to make sure that they're getting their regular cervical cancer screenings,
Yeah, I
right?
mean, he's
Because
on the phone. The
that's when
laptop.
you would
Yes.
recognize if
Yes.
maybe
Yeah.
you have fibroids and you think that that's the reason for your bleeding that you're having, irregular bleeding you're having. But when you go for your pap smear, your cervical cancer screening, that gives an opportunity to identify if there's something else also going on that could be cancerous or something else precancerous, right? So I think that's a risk in terms of the connection is because there's room for overlap in the symptoms. You can possibly be fooled into thinking the fibroids are the cause of everything. But if you're getting your regular pap smears, you will be able to detect, if there is another, more serious cause going on, like a cervical cancer or precancer.
Thank you. Thank you so much. We do have a question. They want to know, does the IUD play a part?
Question. No, the IUD does not impact rates of cervical cancer. So the IUD has been shown to potentially lower the rates of uterine cancer because of and this is specifically the hormonal IUD, not the copper IUD. The hormonal IUD, the way that I'll speak about that for a minute. So as most people know, typically every month, when you are going through your monthly cycle, you have a growth of the lining of the uterus, right? So there's a lining that grows in your uterus, and then that lining sheds at the end of the month, and then it grows back, and then it sheds, right? Unless you become pregnant, in which case the lining does not shed, and oftentimes not getting a period is the first sign people know that they're might be pregnant. But otherwise, this lining grows and sheds and grows and sheds. When you have a hormonal IUD inside of your uterus, it's a small, like typically plastic device that contains a hormone called progesterone that secretes into your uterus, releases into the uterus, and that signals to your body not to grow that lining every month. And so a lot of people who get an IUD will find that they have lighter periods because they are not growing this lining, so there's not as much of a lining to shed. And because of that, the IUD can potentially lower the risk of uterine cancer because a lot of uterine cancers actually begin in that lining where the lining grows. And you might know people who have conditions where they don't get their periods, like PCOS, for example. They don't get their periods regularly. That lining is growing, and over time, it can sort of overgrow, and you can get abnormal cells that are supposed to shed. And because they linger, they can start to take a turn, and can eventually turn into the start of a uterine cancer. So because the IUD decreases the growth of that lining while it's in place, particularly for people who have those conditions like PCOS, it can actually decrease the risk of uterine cancer. It's not, it hasn't been, related to the rates of cervical cancer. So cervical cancer, just to make sure we're on the same page, the
Mm-hmm.
cervix is actually a part of the uterus. Okay, if you imagine like a papaya or an avocado, something shaped like that, um, the uterus is the body, right? The bulky part of it.
Right.
And then the cervix, or even if you think of like a just like a soda bottle, the or a water bottle, right? You have the bottle, that's the body of the uterus, and that's where the lining grows inside of. And then you have the little neck of the bottle, that's the cervix. It's the opening at the bottom of the uterus. So that part does not seem to be affected by IUDs. But the upper part of the uterus does seem to be, protected by hormonal IUDs, and there's a lower rate of uterine cancer.
Great. That is good. You have taught us a lot today, and we now know what HPV vaccine is very important for our young people. We know that, and I know that a lot of parents are leery on this vaccination. Um, what are the side effects? And you just already talked about the side effects is just the soreness in the arm, and and then they think of, because it's a virus prevention, they think that it is a virus that you're putting into the body to prevent the virus to become, so that part, I think a lot of parents are really leery, just like they did for COVID. They shot us up to for the vaccination. It was just a virus so that the body can fight the virus. So just quickly, okay, someone has a question. Reverend Foley, you have a question.
Yeah. Dr. Best, thanks very much for the education. We know that knowledge is power. This section seems to be about the women, but I got concerned when you said that the HPV virus is transferable. Did I hear that right?
Yes, that's right.
All right. So it is transferable, then we do have to be concerned. Yeah. So is there any symptom for the men to know whether because it is called cervical cancer. I don't know how it is called on the men.
Yes, that's a thank you for bringing that up, because I missed that opportunity. So I'm glad you brought me back to it in my initial, discussion. So first of all, I want to make it clear that this vaccine is recommended for everyone regardless of gender. So it's not only for women. Because as I mentioned, there are other types of cancer that can be caused by the HPV virus. So, mouth, throat cancer, anorectal cancer, penile cancers, those also can be caused by the HPV virus. So cervical cancer is, again, that's the one that we talk about the most, and it's the one that we know the most about. It's been the most studied, but we have lots of data that actually does show us that those other types of cancer, oral mouth cancers, penile cancer, and anal cancer also can be caused by the HPV virus, right? And so I think that covers, just between that and the cervix, I think we've covered just about every human's body parts. Okay, everybody has a mouth at least. So there's at least, that possibility that anyone can get a cancer due to HPV. So we do recommend this for kids regardless of their gender. And then the other thing is, as you mentioned, Reverend Farley, it's transmittable, right? So the more people in our community that are protected against getting this infection with the HPV virus, the less people there will be to spread it to others, right? So we want to make sure that all teens and all young people, and then everyone even up to age 45, right, is getting vaccinated and protected against this. Because as we've seen with other vaccines, the more people that are vaccinated, the less this vaccine is able to spread within a community, right? And the fewer lives will be lost to this virus. So you were asking about any signs and symptoms. One of the common signs of an HPV infection can actually be genital warts. So, of note, there's a lot of different types or a lot of different strains. We all know strains now from COVID, right? There's a lot of different strains of HPV viruses, and they have numbers, 16 and 18 and 9 and different things. So, there's a lot of different strains of the HPV virus. Some of them tend to cause cancer, and others don't typically cause cancer, but they cause other symptoms like genital warts. So, genital warts are basically it's a wart. So, it's growths that you might see in the genital area. Um, People describe them as they look like little buds of cauliflower or little mushrooms that sprout up on in the genital area. And that's a common sign people can, recognize for themselves, or they, might recognize they have something growing that was not there before. I always encourage you in these talks, if you see something growing on your body that was not there before, you should see a healthcare professional to have it checked out, right? Um, Unfortunately, in a lot of cases, the growths that you would see um, on your genital area are actually not cancer, but they are due to the HPV virus, but they're benign. They can be bothersome. Sometimes they get, caught on your clothing, so they could be painful. Or sometimes they just, people feel shame about having these warts and stuff, and they're treatable. They can be removed if people want them removed. But that is typically a sign that you have been exposed to some strain of the HPV virus. So that would definitely be one to look for. As with other types of cancer, by the time you would see a mass from a cancerous strain, that means you have cancer, right? So we're not looking to wait for that. If you see any of these and you think it's a wart and it's benign, you want to see your doctor. And this is where the screenings that we have, like the cervical cancer screening, that, we would be able to detect. We're looking under a microscope when we do cervical cancer screening. So this is way before the point where people would have bleeding or where they would have a mass or pain or anything. We're looking way before that. There's research that's going on right now about oral cancer screening. A lot of dentists have started to incorporate some degree of oral cancer screening. So that's a good, available step. See your dentist and they can do an oral cancer screening. And then there's also research going on about penile cancer screening as well. So we don't have a similar, good test where we can test early, look under a microscope and that sort of thing for penile cancer. But hopefully that's something coming in the future. But in the meantime, because we don't have that, the best thing we can do for men is going to be the vaccine.
All right. I got boys, 16, 17.
Oh.
They know nothing about uh, sex.
Okay.
Is it possible to tell the primary doctor to give them the vaccine at the stage?
Yes.
Or, okay.
So that is a perfect time if they have not already. So if I were you, when you get off this call today, I would call your son's pediatrician, their doctor, and make an appointment to talk about this, because your doctor should have already talked about this to you and your sons. And maybe they did and you don't remember. So check with them and see, did your sons actually already get this vaccine? But if they have not received this vaccine, I would say the responsible thing for you as their parent is to, your job is to protect them and to use the tools available to protect your children, and to keep them safe and healthy. So I would say if your doctor has not brought this up, you definitely should bring it up, now or at their next visit, to say, hey, I've been doing my research. We've been having these conversations as part of our church community. And I learned about the HPV vaccine. I learned that it is recommended for boys in the age group that my sons are. How come you haven't talked about this? Is this something they should be getting? And push your doctor. They should be able to answer those questions, because, it's their responsibility to make sure that you, as the parent, are getting the information you need to keep their patient and your sons healthy. So absolutely, if those were my sons, they would be vaccinated yesterday.
Thank you.
You're welcome.
Thank you. Thank you, Dr. Betts. We really appreciate all this information. Anyone, if you're watching or going to be watching, please, if you have any questions, please contact us. The Ministers Alliance is here to navigate with you and for you to go where you need to go. We will get the information to you. We have brochures and literature about the HPV vaccination and other literature that we have. So please do not hesitate to contact us. And you can contact us right here on YouTube, Facebook, on any social media, and we will get you the information. Before we go, we have a survivor. Norma, we thank you for being on. But before we have you, we want to hear from Megan. Megan is the director of the Partnership Reduce Cancer of Rhode Island. So we like to hear from her very quickly. Megan?
Hi, everyone. Thank you, Pastor. Yes, so I'm executive director of the Partnership to Reduce Cancer in Rhode Island. We're the state's cancer coalition. And I know my coworker, Sarah Gingrich, has been on many of these calls and has provided some information. But I just want to share that we're a resource for the community. We serve the entire state of Rhode Island. We're here to provide additional education or resources, connect you to whatever you may need if you have further questions or want to learn about other areas of cancer screening. We have additional brochures and literature as well. And I know the Ministers Alliance have some copies of that. That we're always happy to get additional ones out, whether it's to your practice or to individuals. And just on the topic of cancer screening, we do I'm going to put a shameless plug in here. We do our skin checks, our skin cancer screenings over the summer. And so those will be kicking off at Pride Fest on June 15th. And we'll be sending out a flyer with the finalized dates, hopefully within the next couple of weeks. If you want to get a free skin cancer screening by a dermatologist, you don't have to worry about waiting for an appointment and waiting 6 months to get in. You can just go down to your local beach and we can get you screened. Yeah, I think that's it, unless there's anything else you want me to mention.
Well, we do have, I want to let them know that we have been working closely with you. And if anyone needs more information and don't know how to get to the partnership, we will navigate you to them. They are very active in what they are doing. And so we really appreciate it. Just in case, and I'm going to put that in our chat, in our comments on Facebook and YouTube, but it is www.
I put it in the chat.
It.
It's www.prcri.org.
Thank you.
It's in the
Thank
chat
you.
on
And if
Zoom.
you can, someone go on Facebook and YouTube and enter it there too, because we are live. So that would be wonderful. And also I would like to hear from who I haven't seen in a little bit. It's Steve Williams from Rido, and we would like to hear from him. Hi, Steve.
Everyone. Steve Williamson. For those of you who don't know, I work with the breast and cervical cancer screening program and also the colorectal cancer screening program. And we're always interested in hearing about and helping to spread the word that HPV vaccine can help to prevent cervical cancer. Is really the most effective thing available to prevent cervical cancer. So we work with the Department of Immunization regularly at community events, trying to get that word out. And it was good to be here today. Good to hear Dr. Best, and like to help out in any way we can.
Thank you, Steve. We appreciate what you're doing. And of course, I'm going to need more literature. So we will be getting together on that. We thank you. Norma, we have Norma as our survivor, and we have a few minutes left so that we can hear her testimony. Go right ahead, Norma.
Thank you so much. Sorry that I jumped on a little late. I was on Zoom at my job, and the meeting seemed to be, a little bit longer than it should have been. But anyway, thank you. And hi, everyone. I'm Norma Hardy. I was diagnosed with non-epithelial ovarian cancer in the spring of 2010. The tumor cells were encapsulated in my left ovary, and there was no lymph node involvement and no metastasis. All right. I had no family history of ovarian cancer. I had no symptoms like bloating or feeling full easily, or no frequency of urination, nothing at all. At the time, I was I still am. I don't work as in that field, but I had been a health educator, had worked in research on health topics. And at that time, I had no clue that I had non-epithelial ovarian cancer. I felt as though I had a balanced diet. I was never a smoker. I didn't consume alcohol. I had no symptoms. So that's where I was. However, 11 years earlier, I had had a hysterectomy. And I remember asking my doctor, why was it that the intention was to remove my ovaries and my uterus and my fallopian tubes. And she did say to me, sometimes they cause trouble down the road. But then I asked her if there was something wrong with my ovaries, because I didn't feel as though there was anything wrong with the ovaries. There was something wrong with my uterus because of fibroids. But she said, no, there was nothing wrong with them. So we agreed that, I didn't want to get into premature hot flashes and all those symptoms. So the plan was to keep my ovaries, but keep watching them, And although I would go in on an annual basis to see my primary care physician for my physical, I would also go in to see my gynecologist for my annual checkup with her. And without telling me that she was necessarily keeping an eye on my ovaries. Ovaries are very tiny, by the way, but she was keeping an eye on them. So in the spring of 2010, I had gone in for a routine exam, and she felt like the left ovary was a little bit bigger than the right one. So at the end of her exam, normally she would say, Norma, everything looks good. And we would talk briefly, and I'd schedule my next appointment for next year. She said, the only issue that I've seen is that your leftover feels a little bit bigger than the right one. And I remember saying to her, why is that so? And she said, I don't know, but I'd like you to go do an ultrasound. In retrospect, that was a transvaginal ultrasound. And she got the result a few days later, and she called me up and she said, do you have a minute? And I said, yes. And she said, the ultrasound shows that you have a cyst on your left ovary. And in the middle of that cyst, it's a large cyst. In the middle of that cyst is a small, hard area. And in that area, there are some cells known as granulosa tumor cells. I said, well, are those malignant or are they benign? Because I want to know. I want to know. I'm not one of those women that don't want to know what's going on in my body. I want to know. So she said, we don't know. So at that stage, I was ready to get rid of my ovaries. So we were talking about surgery and all of that. And she said, well, after the surgery, or during the surgery, a sample can be taken of that left ovary, and that would be biopsied, and we will know. All right. So clearly, I was ready for surgery to remove my ovaries. So I did ask for laparoscopic removal because I loved my job, and I felt as though if they were removed laparoscopically, that would give me time to return to work because, of course, I like my job, right? So, yes, the surgery was scheduled, and yes, the ovaries were removed. However, the left ovary was so wedged into the scar tissues that were left over from my 2 C-sections. My 2 children were born by C-section, and I had a lot of scar tissue. So, that ovary took a longer time to be removed. It had to be chiseled out. The right one, they just pop it out. The left one, they had to chisel around and chisel. And in so doing, it broke into several pieces. It was shattered. And so now the problem was, did a spill occur? They vacuumed up, because I did ask the gynecologic oncologist that worked with her to do the surgery. I said, well, did you get everything? And he said, well, it did seem so. We mopped up as much as we possibly can. We vacuumed up everything, but why don't you go do a CAT scan? The CAT scan did come back clean. So it was assumed that everything was caught. But at that point, it was suggested to me that as a precautionary measure, I could do some chemotherapy. But I was not comfortable with chemotherapy when it was known that, there was a spill definitively. And yes, we didn't even get the result. So it was decided that it was stage 1C. It was non-epithelial. Of course, the classic ovarian cancer is not non-epithelial, it's epithelial. One other thing that I learned was that the non-epithelial ovarian cancer had tumor cells known as Sertoli-Leydig tumor cells, most likely named after the guy that discovered it. I did not accept the precautionary chemotherapy, but I decided I would do my own research and see what's available. I was cautioned about Googling, ovarian cancer, because my doctor said it was so scary, and I may be scared stiff. But I did my research, and what I discovered was that I could have labs every 3 months and to see if anything showed up. And with my kind of diagnosis, inhibin A and inhibin B were the 2 tests that were done and still are done to determine whether everything is okay. So inhibin A, I believe the level should be under 10, and inhibin B, as long as it was under 30, I would be fine. So for the first 3 months, I had the labs done and the values were perfect. They were under 10. Another 3 months, perfect again, they were under 10. It was when I went for my third 3-month labs that a few days later, my gynecologic oncologist called me and he said, do you have a minute? And I said, yes. And he said, your labs were a little elevated. I believe my inhibin A was 12 instead of under 10, and B was about 45. So that was clearly elevated. It was suggested that my case be taken to tumor board because it was considered a recurrence. So it was at this point that I pretty much asked if my husband and I could attend tumor board, because I want to be I want to be an informed consumer, informed patient. I want to see what's going on with my health and my health care. So I remember the gynecologic oncologist saying to me, well, that's not the norm, really. People don't usually ask to come to tumor board, but he said, I'll ask and get back to you. He got back to me pretty quick, and he said, yes, I suppose you and your husband could come to tumor board. So long and short is my husband and I went to tumor board. And, for confidentiality, we didn't see other people's cases, but my case was projected. And I could look at the history, I could look at the new development, I could look at everything from the surgery, what happened with the biopsy, the results, everything, and the recommendations. And it was recommended that we would do a CAT scan to make sure, uh, the CAT scan did show that right where the leftover was removed, there was a little dot. And so they wanted to know that this, whatever was happening at that part of my anatomy, had to do with the same tumor cells, Sertoli-Leydig tumor cells. So I had a needle biopsy, which did show that, yes, those were the Sertoli-Leydig tumor cells. And most likely that was the result of the spill. So I had surgery, and the surgery was performed, I remember, on March 16 of 2011, and it was discovered that the tumor cells had settled on top of my sigmoid colon. And so I had a tumor, I had a resectioning done, right, to repair my, what happened, they did a little, I think the V part, to catch all of the cells that were there and cut that out and then pull the sides together. A colon resection was done, and post-surgery, a CAT scan was done, and it came back clean. And so it was recommended that I had three chemo components in my, what I call my chemo bundle, or my chemo cocktail, and that I have 4 treatments of chemotherapy. That sounded good to me. And so we started chemotherapy, and that ran for about 3 months. It should have been a shorter time, but I had 2 setbacks. After my first chemotherapy, my neutrophils were so devastated. They were totally gone, almost totally gone, that when I went back for my second treatment, I could not have chemotherapy because I had no defense mechanism almost. So I went back to work because I felt good. I went back to work, and after a week, my neutrophils came back up. I had my second treatment, and then the third was okay. Then I went back for the last one, and my neutrophils again were almost gone. So went back to work again. After a week, they came back up, and that was my 4th treatment. And after that, I would go in every 3 months for lab work, and they were just checking inhibin A and inhibin B. The classic test is CA-125. That doesn't do a thing to indicate what's going on with me, with this non-epithelial ovarian cancer. So every 3 months, I would go in, and after about 6 months, they decided that I didn't have to come back every 3 months. So I started going every 6 months to do the same test. And after going maybe a year, 2 times, it was decided that I didn't have to go back every 6 months. I could come in every year. So once per year, I go in to check inhibin A and inhibin B and to see where my levels are. I remember something that is noteworthy. While I was waiting for my results after the laparoscopic surgery, I remember my gynecologist calling me, and she said, "Norma, do you have a very heavy voice?" I said, "Heavy voice? What's that?" And she said, and do you grow a beard? And I said, "I don't think so." She said, the guy that did the test, your biopsy, he doesn't know me from Adam. So he's saying, does she have a very heavy voice, or does she grow a beard? I guess that's typical of individuals that are diagnosed with sertoli tumor cells. So I guess my case was a little bit different. What I did notice, though, for chemotherapy and as a woman of color, um, I had quite an amount of hyperpigmentation um, and quite an amount of neuropathy in my hands and my feet, the bottom of my feet and the palm of my hands. But after a while, my body took care of that. I think my body healed itself. And I no longer have neuropathy in my palms or the bottom of my feet. What I did feel, or what I sensed though at that time, was when I was walking, my feet felt as though I was walking on water. My friends would, and I would joke that I was maybe Jesus walking on, on water. It was my feet just felt like I was walking on water all the time. Um, I would use colorful nail polish to color my nails because they were beaten with a hammer, black and blue. And my gums were not the nice pink color. They were like very dark. So I guess that was chemo. But
Yeah.
after a while, all of that worked itself out of my body. And today I'm grateful to God that I'm cancer free and has been cancer free for quite a few years. So that's my story.
Thank you, Norma. I do want to say knowledge is power. Knowledge is power. Um, I know that you are in the medical field, so you were able to get more information because you knew about the information that is needed for your body. But can you just quickly just talk about women? What can women do that don't have that knowledge? You know what I mean? You did notice some things, so just help us with the
Mhm.
women that don't have that knowledge and not sure what to do.
Mhm. Well, before my diagnosis, I had fibroids, and Dr. Bess was talking about that. If women notice that they're having heavy bleeding or other kinds of symptoms, they should not shy away and they should be checking in with their PCP or their gynecologist. And, there must be a reason behind this kind of a symptom. So, one thing is to get information, check with the source. Your PCP is a very key person in this big scheme of things. The other thing is women can help women. If there is a presentation like the Ministerial Alliance is providing in conjunction with the Cancer Partnership, they're providing this kind of service. I think women should try, and men too, should try to attend and get this information firsthand. Or if they can't, you have it on Facebook and other social media. Tune in to these medium or these media and get the information. There's a whole lot of printed materials.
There
Get
is.
it
There is.
or listen to it or view
Yes.
it and get information. And women can come alongside women and help them as well.
Thank you. Thank you. That is so true. That is true. And this is why we are passionate in what we are doing in this cancer initiative. We really want to thank everyone. We want to thank Dr. Best. Thank you so much for the HPV vaccine. Norma, thank you so much. I appreciate you and your testimony. We will be calling you back soon, um, and when you are available. Steve Williams, thank you. And our supporter, she is our great supporter, Kelly Smith. Thank you, C. Kelly. We appreciate you. C. Kelly is the one that got us started in this initiative. And then, as soon as it started going on and taking its way, taking on its way, we got more passionate because of more information that we have learned with these cancers that we're focusing on, and it has overlap to other cancers. So Thursday, this Thursday, May 30th, the Ministers Alliance, is having a another community conversation, and it is going to be for men. Men, we need you to come. And it's going to be at 65 Narragansett Avenue in Providence. 65 Narragansett Avenue in Providence. The church is Kingdom Culture Community Church, where the pastor is Apostle Sherrod Jones. And it's going to be at 7 o'clock p.m. And we're asking men, please come on and let's discuss of the cancers that are there for men. That we will be talking about the prostate cancer. We have Dr. Fast that is going to be there. We will have survivors, prostate cancer survivors there. All information for screening. So we're asking you to come. Of course, it is free. And all of these community conversations are free. If you're not able to meet us there in person, we are on Facebook and we are on YouTube, and it will be live. If you have any questions, please put it in the comments, chat, or whatever, and we will get your comments and questions answered. So we want to thank everyone for being on today. And we're just going to continue the community conversation. You watch out, look out. We will have a schedule for June. Also, too, we will have information on screening, where you can go to have your screening for all of these cancers that we are focusing on. So we want to thank everyone, and God bless you.
Thank you.
You're
Thanks,
welcome.
everyone.
Bye-bye.
Thank you.